In September of 2024, a massive landslide hit Anandaban Hospital. The landslide was a result of torrential rain, which was the heaviest rain to hit Kathmandu on record. Large sections of earth, rocks, and debris tumbled down towards the main highway at a rapid pace. Trees were uprooted, and the sound of the sliding mass echoed around the hospital. The landslide severely damaged the hospital premises, including the Training and Technical Center and the Self-Care Unit, Trauma Center, Mycobacterial Research Laboratories, and the leprosy wards. The immediate response team activated emergency protocols, and urgency was given to rescue efforts and prevention of further damages. Patients were moved to the trauma center, evacuating leprosy wards. By October, immediate services like water, electricity, and telecommunication were restored. The next challenge facing the hospital was the monsoon season. With only 7 months to the next monsoon, immediate planning had to be done to prevent further loss of life in buildings. Buildings under threat were evacuated, and a geological survey conducted to understand the extent of the full damage. The survey concluded that the land around the hospital was at constant risk of future landslide. As we planned for the monsoon season, safety of our staff and patients were our number one priority. But we also wanted to continue serving people in need. The best option to do both was to move Anandaban Hospital to a new location. And the building housing the Parton Clinic and the country office was our best option. In the months that followed, the country office was evacuated to a new location to make way for Anandaban Hospital. Offices were turned into wards, and patients filled the once quiet hallways of the country office. But the office building in itself was not big enough to house all of our services. The research building moved to a temporary new location, as they continued their search to find appropriate land for building a new laboratory. The self-care unit was moved to New Saddle, a partner organization. While the training unit building was badly damaged, the spirits of the team were not. Ever since the landslide, the team has been even more active and has been conducting training with an external focus. As we look towards the future, we are committed to serving people in need. But we also want to make sure that we have a safe and secure hospital to do it with. In keeping with the conclusions of the geological surveys and the lurking threat of disasters at Anandaban Hospital premises, we have now started discussions on whether we should move the hospital to a new, safe location. And we will need your support to do so. We are thankful for the support and fellowship around the world and pray that God will guide us to the right path.